Welcome to Ethio EMR, Ethiopia's multi-tenant electronic medical record platform. In this short guide, we will be exploring the patient chart. As you remember from our previous training video, we have seen how to process a patient from central triage or emergency triage and process payment and call from the queue. And now we are going to be starting from the OPD. In the OPD, the doctor or the service provider is going to be able to open the patient chart. In the patient chart, we will be able to see the patient summary. Here we can see the vitals that have been recorded in the triage. Anything that we enter will show up here in the patient summary. Next, we will find vitals and anthropometrics. Here we will see the different pulse rates and saturity and details of the patient. If we need to add more of these vitals, we can add them here at where it says record vitals. We also have a trend analyzer here in the chart, which will show us how these different vitals have changed over time to help the doctor better treat the patients. Whether medications have been ordered previously can be seen here in the medication section of the patient chart. So any active medications or past medications will be listed here. In the care panel, we will see if there have been any care panels registered here. Under orders, we can be able to see any orders that have been made for the patient, whether labs or drugs. We will be able to see them here. In the results section, we will be able to see any results that the patient has been ordered. Under the visit section, we will see all the visits that the patient has made. If there were multiple visits, we will see them listed here. If we click on the drop down, we will find the timelines and the different encounters that the patient has had in their visit. Under allergies, we will be able to see if there are any allergies that have been recorded. If we would like to record allergies, we can click on record allergy intolerances, select the kind of allergies that they may have. For example, if they are allergic to aspirin, we can put this, and then we select the reactions to that allergy. And we are able to record the severity of the reaction from mild, moderate to severe. We can provide additional comments and save and close. And we will now see that allergies have been saved in the patient records. Under conditions, we will be able to see any conditions that the patient may have. We can record conditions. For example, if our patient is hypertensive, we can see, we can click here and we can put in the onset date from when this condition has been happening, whether it's an active or inactive case. We can later come back and edit if it's no longer active and save it, and we will see condition successfully saved and it will appear here. Immunizations are usually used for children, but any immunizations can also be seen here. We can record immunizations from the list. For example, yellow fever can be considered for adults, or when there is an outbreak, we can record immunization and date of immunization that has been done, when it will expire, if it's for 10 years, and register immunizations. Attachments will be able to show us if there are any attachments, imaging from lab orders, or any attachments can be seen here. Appointments can be seen here. Doctors can add appointments for upcoming appointments, allowing or choosing a location, whether it's a recurring appointment, and be able to provide these services for the patient. Once we've seen these items, we can now go back to the patient summary, and on the right hand side you will see a number of items. Here we will have clinical forms. These clinical forms are different forms that the OPD doctor may use to input any examination records for the patient. For example, if we click on the history and examination form for the patient, we can provide those details. The doctor can put in the provider name, where the location is, and then what the complaint is. For example, if they're having abdominal pain, how long they've had it, whether they've had it for hours or days, and then we can add that. And then we can add history notes. We can add questions, as you see. If the patient has additional complaints, we can add history notes. They have smoking history. What is the plan to treat these patients? We can upload images and videos, different things that we can do here in the charts, and that will show up in the patient summary. So we can use any of these clinical forms as needed to input information for the patient in the patient chart. Therefore, this gives us an idea of how to navigate the patient chart and input the necessary information. Thank you very much.